Hi everyone, my name is Aritra Chakraborty, and my presentation is on the vaccines and the anti-vax movement. So a bit of an introduction regarding vaccines. Vaccines have been known to eradicate many diseases. Some of them have included smallpox and rinderpest. And vaccines have played an essential role in eradicating, smallpox. Smallpox has been a disease that has plagued the world for a long, long time, and thanks to vaccines, we've had smallpox eradicated. Now, currently, we've had parents in Western countries refuse to vaccinate their children for a variety of reasons, and most of these fears come from their religion or just general misinformation from the public. Um, So, areas in Western countries where measles is considered eliminated, the virus is considered eliminated, measles outbreaks still occur in these countries. And that is a very concerning thing given the fact that, they are considered eliminated. So, there could be that element of anti vax movements that are contributing to these measles outbreaks despite having that virus considered eliminated. And this is from NIH data. So, a little bit about how this anti-vax movement started. Um, Actually, this movement has been going on for a while, for centuries, but it has really gotten its movement back in current times with Andrew Wakefield, who was a former British physician, and he published a paper in the Lancet in 1999. And what this paper did, it suggested a connection between the measles vaccine and autism in young children. And after a lot of people took a look at the sort of work he did, they discovered a lot of his research methods and a lot of approaches that he did were completely flawed. On top of this, he was being funded by people that were in a lawsuit against vaccine manufacturers. So you could see that there's a conflict of interest there too. And when they found out about this funding, nobody in his team, none of his coworkers and or people in medical authority had any idea about the funding he was getting from all these conflicts of interests. So all these things coming into light led to a lot of his work being retracted, and as a result, his medical license was also revoked. Hence, you can see he was a former British physician and not a current British physician. So, despite of all of that, this movement still grew, and mainly the growth in this movement has been credited to celebrities having time on the air to talk about their views on vaccinations. And one really big, for lack of a better word, face of the anti-vax movement has been Jenny McCarthy. And Jenny McCarthy has been invited to many talk shows. Um, Again, Jenny McCarthy has argued that vaccines can cause autism, and she uses her son as an anecdote for um, that her son was vaccinated, and her son developed autism as a result of all of that. And she talked about these sort of things on Oprah Winfrey's show. She also was invited to Larry King and Good Morning America, and this really allowed her to have a window for a much larger audiences. Almost 15 to 20 million people have seen Jenny McCarthy talk about um, all this nonsense really about vaccines causing her son to get autism, and really dismissing the power that vaccines have on our society. So, regarding how the data grew regarding the anti-vax movement, um, just a statement about the efficacy of vaccines. They prevent 2 to 3 million children's dying per year. So if we had more vaccinations, we would save that many lives. 3 in 10 people generally think that vaccines are not mandatory. And regarding the measles vaccine itself, 9% believe the vaccine is actually harmful, and another 7% are not sure about it being good or not. Um, and this becomes even more concerning because the percentage goes up for parents of minors. That goes up to almost 13%, which is a pretty significant fraction. Now, if you want to have herd immunity in a society, you'd want vaccination rates of about 96 to 99%. And you can see here with your 13% for parents with minors and 9% believing that vaccines are actually harmful, you can see that there is a gap between having a successful herd immunity with vaccination and a percentage of people who believe that vaccines are actually harmful. If you go to this pie chart on the right, 83% believe the measles vaccine is safe. 9% are not believe it's not safe, and you can see with respect to the proportion of 83% what percent believe it's not safe. This survey was conducted back in 2015, so it may be a little bit dated considering that this all this data was taken 5 years ago. But I'd like to believe that largely it has stayed the same throughout this time regarding views of uh, anti-vax sentiments. So getting into a bit more data about the anti-vax population, anti-vaxxers tend to be more towards younger, minority, and less educated Americans. Just based on looking at it from a just educational standpoint, you can see on that table on the right, this is collected from Pew Research Center, and it was on a Washington Post article talking about how many Americans are actually anti-vaxxers in this country. And we can see that 92% of college graduates see vaccines as safe. And you see that number going lower the lower your education level is. So some college experience, you're going down to 85%. And those with a high school diploma or less, it goes down to 77%. So that seems to follow the trends of what less educated Americans tend to be more anti-vax. Um, you can see here younger people also tend to be more anti-vax on this table right here. 18 to 29 years old are 15% believe that it's not safe, the measles vaccine or the MMR, measles, mumps, and rubella vaccines are not safe. That as you get to like age 50 to 64, you're going to 6%, which is a much lower number than 5%, 15%, sorry. And you can see that younger populations tend to believe that vaccines are more unsafe. You can see also in this graph with white versus non-white. I personally I don't like how this is presented, how it's only white and non-white, which is pretty vague categorizations. I personally would have liked to see uh, more different categories of ethnicities. So maybe we could see what specific ethnicities would be better targeted regarding information about the benefits of vaccines. But I didn't make this. Pew Research Center did, and they have deemed that non-white are not, and 17% believe that it is not safe to have a vaccine, and 6% believe it is not safe for white. So as you can see with this data, as much as I don't like the way it is categorized, that minorities tend to be more anti-vax than non-minorities. So what are some of the possible solutions we can look at to tackle this issue with anti-vaxxers? We see that people who paid more attention to any news about the measles and vaccinations were more likely to say that vaccines were safe for healthy children. And people who didn't really follow any of these measles outbreaks at all, they were less likely to say that vaccines were safe. And actually, almost a third of them would say that they were unsafe. So you can see that ignorance is playing a pretty big role regarding anti-vaxxer views. So this really shows that if we want to tackle the issue with anti-vaxxers, we're going to really need to work on informing the public regarding the benefits of the vaccination. So some ways we can tackle that is having earlier communication in the process for couples that are pregnant or expecting a child. Um, so while someone is pregnant, they would be more receptive to discussion, and this is talked about in the Journal of Public Health Management and Practice. Um, rather than giving birth, rather than talking to them about their views on vaccination after they have given birth, um, talking to them about their views on vaccination beforehand can give them a better gist of um, their views on vaccination, and having better conversations of evidence-based information for parents to make better decisions about vaccinations would be beneficial, as there would be more receptive to discussion pre-birth compared to post-birth of the child. Um, so another way we can tackle the anti-vax movement is kind of use what Jenny McCarthy used in spreading her views on anti-vax against her. So in her case, she was using more her spotlights on TV shows. Um, Now, with the current age of social media dominating our lives, we definitely can have better coordinations between healthcare professionals and social influencers. And this can really target audiences and spread discussion about vaccinations through social media. And social influencers can really discuss the importance of vaccinations and really the harms of not vaccinating children on social media. These days, we're all on social media. We all know social influencers on these social media platforms. They can really cause a great shift towards a more receptive environment for vaccinations compared to these anti-vax sentiments that continue to plague our society today. So, regarding the anti-vax movement, and given the fact that we are in a global pandemic, my question to you all would do you believe that the anti-vaccination movement will affect the spread of COVID-19's the vaccine of the spread of the COVID-19 vaccine once one is developed? And do you guys think that the anti-vax movement would affect the distribution of this vaccine? And how would you believe they would do that? And what are some of the ways we can deter this from occurring when the vaccine becomes available? We talked about some of this with my solutions regarding the how to better target anti-vax, but more specifically, how would we be able to do this once a COVID-19 vaccine is available? And here are my sources for the things that I've used in this PowerPoint lecture. You can take a look at these articles. Definitely got a lot of good information from these. Thank you all for listening to my presentation.